ES College of Nursing, Villupuram. Strive, serve, shine.
Hello everyone, this is Buvaneswari, nursing tutor from ES College of Nursing. In this session, we explain about the arterial blood gas analysis. Arterial blood gas analysis test measures the O2 and the carbon dioxide level of the blood, and also we assess the pH level of the blood. The normal pH of blood is 7.35 to 7.45. In case the less than 7.35 we indicates acidosis, greater than 7.45 we called as an alkalosis. Blood gas analysis, blood sample can be obtained by puncturing the artery. It may be femoral artery or radial artery or in the brachial artery. The kidney and lungs works as a compensatory mechanism. Why? Because of the kidney maintains the bicarbonate level and the lungs maintains the PaCO2 and PaO2, that is partial pressure of carbon dioxide and partial pressure of oxygen. Next is the definition. Arterial blood gas analysis is a diagnostic procedure in which the blood sample can be obtained directly from the artery. It may be femoral artery or in a radial artery with the help of pre-heparinized syringe and needle. And next is the purposes or uses of ABG analysis. In this, to determine the presence and type of acid-base imbalance of the patients. It may be a base excess or base deficient will occur. And second is to check for severe breathing difficulty. In case the patient is having breathing difficulty means, on that condition we will do the arterial blood gas analysis for identifying the partial pressure of oxygen. And third is to assess the blood oxygenation level. In this, for example, the patient is having any respiratory conditions problem, they having the saturation less than the 80%, and then PaO2, the partial pressure of oxygen is less than the 80 mmHg will occur in the ABG analysis. And next, in case the patient is in a mechanical ventilator, for assessing the therapeutic regimen, there is an improvement occur for that patient. These are the uses for the ABG analysis. What are the normal ABG values is? The first is then pH 7.35 to 7.45. In case the pH is less than 7.35, we called as an acidosis, and greater than 7.45 we called as an alkalosis. And second is then partial pressure of O2 or PaO2, the 80 to 100 mmHg. And next is then PaCO2, partial pressure of carbon dioxide. The normal range is 35 to 45 mmHg. And next is then HCO3. HCO3 is nothing but bicarbonate. The normal value is 20 to 26 milliequal per liter. These are the normal values of ABG analysis. And next is then in which condition we will do the ABG analysis means. The first is then respiratory failure. In case the patient is having type 1 respiratory failure, we called as an hypoxemic respiratory failure. You will assess the ABG analysis means, in that cases, the partial pressure of O2 is decreased for that patient. Or in case the patient is having type 2 respiratory failure, that is hypercapnic respiratory failure. In this, the PaCO2 level is greater than 45 mmHg will occur for that patient. Next is then cardiac failure or heart failure. In this condition, the patient is associated with pulmonary edema means they leads us to respiratory acidosis. Respiratory acidosis is nothing but the pH level is less than 7.35 and then PaCO2 level is greater than 45 mmHg. Next is then a renal failure. We already know that the kidney maintains the bicarbonate level. In case the failure of a renal, kidney will occur for that patient means and that condition what will occur means metabolic alkalosis will occur. Metabolic alkalosis is nothing but the bicarbonate level is less than 22 milliequal per liter and then pH level is less than 7.35 will occur for that patient. And next is then sepsis. Sepsis is nothing but infection which takes place in the blood. And that cases, what will occur means respiratory alkalosis will occur. Respiratory alkalosis is nothing but the pH is greater than 7.45 and then PaCO2 is less than 35 mmHg will occur for that patient. In burns and poisoning conditions, what will occur means is metabolic acidosis will occur. Metabolic acidosis is nothing but the pH level is less than 7.35 and then bicarbonate level is greater than 26 milli-equal per liter will occur for this patient. It is due to the accumulation of toxic products in the skin and then GI system. These are all the indications for ABG analysis. And what are the contraindications for ABG analysis is, the first is then local infection over the puncture site, and second is then distorted anatomy. In case there is a structural abnormalities will occur in the artery. It may be a femoral artery or in a radial artery or in a brachial artery. And presence of AV fistula, that is presence of arteriovenous fistula. We already know that arteriovenous fistula is nothing but anastomosis of artery and venous we called as in a arteriovenous fistula. In this condition, we will get the blood sample means as false or error results will occur for that patient. And next is an peripheral vascular disease of the limb. In case in an artery, the patient is having any occlusion or spasm will occur means there is no collateral circulation will occur for the patients. It leads us to false results. Next is an severe coagulopathy. Severe coagulopathy is nothing but the patient is having any bleeding disorder like hemophilia. Hemophilia is nothing but the patient is having a lack of coagulant factor. In these conditions, increased bleeding capacity will occur for that patient. Next is then use of thrombolytic agents. The patient is having any heart block. In that cases, the doctor prescribed the thrombolytic agents. For example, heparin. In this time, we will do this ABG analysis means the patient is having bleeding time increased will occur for this patient. And next is then articles of ABG analysis. The first is then 2 ml disposable pre-heparinized syringe and 23 to 26 gauge needle and lidocaine optional. It is for local anesthesia and vial of heparin in case the syringe is not pre-heparinized. Means under that condition, by use of the heparin, we will heparinize the syringe. And disposable gloves to maintain the aseptic technique, and then alcohol swab to clean the puncture site, and gas after the procedure to apply firm pressure over that area, and alcohol hand rub to maintain the sterilization, and laboratory form to fill the patient details, a container with crushed ice for the anticoagulant for the blood. What are the common sites of ABG analysis is? The first is an radial artery. Radial artery is the first foremost artery we will prescribe for the ABG analysis. And next is an brachial artery. In case the patient is doing AV fistula means on that condition will not do the brachial artery site. And next is an femoral artery. Femoral artery which is located just below the inguinal ligament. And next is an procedure. In this procedure, first of all, we prepare the patient. In this preparation, first we explain the procedure to the patient about the indications why we do the ABG analysis for that patient. And next is an informed consent that may be verbally after explaining the procedure of the patient, and arrange all articles at the bedside. And next, perform vital signs, temperature, pulse, respiration, SpO2 and BP of the patient. And position the patient's arm by using the pillow at a 20 to 30 degree angle. Next, we perform the Allen's test. Allen's test is nothing but ask the patient first to close the fist tightly, and we occlude the radial artery and ulnar artery at the same time. After we assess the blanching will occur over the palmar region and in the nail region. You will assess that, and we ask the patients to open the fingers and we decompresses the radial artery. You will see the collateral circulation will occur for that patients. And next is then clean the site by using the alcohol swab. We clean the site for 30 seconds. After cleaning the sites, wash hands thoroughly. After hand washing, don gloves and apron if needed. And prepare and administer lidocaine for the patient for local anesthetic affected and allow it for 60 seconds. After the 60 seconds, in case the syringe is not pre-heparinized means, under cases what will we do means is, we will by using the heparin, we will heparinize that syringe. In case any excess amount of heparin will occur in that syringe means is, expel the excess amount of heparin from that syringe. And during the procedure, in this procedure, first what we will do means is, first we palpate the radial artery. After the palpation of radial artery, insert the ABG needle, that is an ABG needle, that is 23 to 26 gauge needle is inserted into the skin of the patient. That may be a radial artery or in a femoral artery or in a brachial artery. Inserting the needle to the skin at the 45 degree. After that, you will advance the needle into the radial artery. After you advancing the radial artery means you will observe the blood can be obtained in the blood chamber. Do not pull back the syringe if needed. Once the required amount of blood can be obtained means remove the syringe and needle and apply firm pressure over that puncture site. Expel any air bubbles occur in that syringe means expel the air bubbles and label the syringe and send it to the laboratory with the crushed ice pack. And what are the post-procedural steps we will do means discard of all the articles and remove gloves and wash hands and check the puncture site for any bleeding or thrombosis, or the patient is having any other complications will occur, and thank the patient for the cooperation. Thank you.